There are children that are under 5 who are most vulnerable, that the population is about up to 1 million of them. The total population of Adamawa State is about 4.3 million at the moment, and about 20% is estimated to be children under 5.
We developed also and tested a new childcare support system in Tanzania 5 years ago, later named Almanach, that helps clinicians successfully in their diagnosis and treatment of common childhood illnesses.
Almanach is a short form for the Algorithm for the Management of Childhood Illnesses. It's an electronic and upgraded version of the IMCI. It's targeted at health workers to help them deliver quality healthcare services to children under 5.
Currently in this facility, we have noticed a significant improvement in the cases that are referred to the secondary health care center. Ordinarily, these are cases that would have been admitted in this place, and management would have been tilted to probably a poor outcome.
In our partnership with ICRC and our Nigerian partners, we provide scientific expertise to ensure that Almanach further unfolds its potential, taking into account the resource limitations that we have in Nigeria.
The Almanach project is a very robust project in the sense that it has translated the IMCI Integrated Management of Childhood Illness modules into algorithms that are much easier to understand by our low-level staff that we are working with, and making it also electronic format safeguards the chances of not using the protocol.
Now the algorithm is imputed into an electronic device like a smartphone, like a tablet, and the health worker uses this during consultation. It guides the health worker step by step, takes them through the processes of checking the child, physical examinations, the appropriate tests to take, and also helps the health worker to come to the correct diagnosis and prescribes the correct drugs at the correct doses for each of these children.
Health workers were using it and were supervised to understand better the acceptance from the community side, and also to understand how user-friendly it is to the health workers. At this stage, there are 11 primary healthcare centers, like I earlier mentioned, using the tablet. And so far, the acceptance has been very, very good from the side of caregivers, parents and guardians, and also from the side of health workers. They have also made mention of how user-friendly and how it has improved their skills in consultations.
In the program here in Nigeria, we already see that the vast majority of children, compared to the period before the Almanach, are now referred to vaccination, are referred to preventive services, are better diagnosed according to national guidelines.
The primary healthcare workers are excited about the Almanach because it eases their work and makes them perform maximally. It helps them give quality healthcare delivery to the children, so they are more confident at prescribing their drugs, at seeing patients. They understand better what they should do and how they should do it and when they should do it. So for them, they are excited, they like it, they are comfortable with it.
First of all, I can say the numbering or the taking data, accurate data of patients, that is children under 2 months to 5 years, have changed. Why? Because the Almanach directly shows us the appropriate guidelines and any vital sciences that we are supposed to take. And also the use of antibiotic. That is the major cases that we are having in these areas.
Since the introduction of the Almanach helped us to less prescription of these antibiotics that we have been doing before. So even the professional practice itself has been changed through the Almanach use. Also, Almanach helps us to make a very good diagnosis compared to before that we have been doing without the Almanach use.
And also it gives us the access to know whether the child has fully have his own immunization schedule. Because in the Almanach, there are certain places that will show whether the child has finished his own schedule of immunization or not. So there we can access the child has finished his own fully dose or there are remaining ones. And also the necessity to go to the laboratory for investigation. At the implementation of this Almanach, it gives us the actual time and actual moment for us to know the child needs an investigation, that is laboratory investigation or not. So I can say that the implementation of Almanach in this primary healthcare gives us a lot, and it also improves our skills with the prescribers.